Colorado ski season is here, and we're getting an orthopedic sports medicine provider's opinion on the most common injuries and how to prevent them. I am with CU Medicine provider Dr. Elise Heise from CU Medicine Orthopedics and team physician for the Colorado Buffaloes. Dr. Heise specializes in the arthroscopic treatment of shoulder, hip, and knee injuries.
By far and large, the most common ski injuries we see in the winters here are knee injuries, specifically to the ligaments that kind of hold the bones together, or the meniscus cushions between the bones and the knee. In skiing, injuries to the ACL or the anterior cruciate ligament are incredibly common. So in most other places that don't have skiing in mountains, fall is really the ACL season with football and soccer, and we definitely see plenty of that here. But it really ramps up during the winter, and we see lots and lots of knee injuries, and specifically ACL ruptures. The ACL is a ligament in the center of your knee, which its purpose is to keep your knee stable. So it keeps your shin bone from translating kind of front to back on the thigh bone, and also rotating on the thigh bone. And without an ACL to stabilize your knee, people typically feel that their knee gives out and isn't trustworthy if they try to do any sort of twisting, cutting, or pivoting activities. So the surgery to treat these injuries involves basically taking a new ligament from somewhere else and putting it into your knee by drilling a couple holes and basically plugging it into the middle of the knee. There's different places you can steal that ligament from, whether it's a different place in your body, or a cadaver, or a deceased person's ligament. And there's not really a right or wrong answer for which one of those you use. I have a personal preference for which one I really like to use for people, and it's a cutting edge technique that involves taking your quadriceps tendon from above your kneecap, and a very minimally invasive 1 centimeter incision that will allow you to recreate that ACL. There is a lot of research on ACL tendon rupture prevention. The majority of it boils down to the fact that we've got to be strong enough to support that knee, and you've got to have the correct brain to nerve to muscle signaling pattern to contract muscles when they're supposed to be contracted to protect against it. And so doing specific strengthening of your core, your hips, your quadriceps, your hamstring muscles is really important, but strengthening is probably not quite enough. Your body needs to know where that knee is in space, and we call this proprioception. So it's a fancy word for balance and coordination. So working really hard on balance and coordination in addition to strength can help prevent those injuries. So for example, instead of doing regular squats, doing one-legged squats and then advancing that to one-legged squats on a Bosu ball or a foam pit or something that's very uneven will help stabilize those little muscles that help in the setting of injuries. I personally do not recommend people go back to full bore skiing until at least 9 months after the injury. And that's with the caveat that you've done a really good job strengthening and rehabbing and working on balance and coordination and proprioception so that your muscles are strong enough to take care of it. We have plenty of studies that returning to these type of sports before that 9-month mark is going to drastically increase your risk of re-injuries. But if you're rehabbed appropriately, you're strong, you've got good balance, you've waited that 9 months, and you're ready to go, then my hope is that you're back without ever thinking about that again, and enjoying a good ski season, and then a good hiking season, and a good climbing season, and everything that you want to do afterwards.